Thank you very much. I had a very good telephone conversation, extremely good, with Senator Schumer a little while ago. We're working on various elements of the deal, and the Democrats are very much wanting something to happen, and the Republicans likewise are very much wanting something to happen. And I think it will. I spoke with at length with Mitch McConnell, and there's tremendous spirit to get something done, so we'll see what happens. But my conversation was very good with Senator Schumer. I thank you all for joining us, and I'd like to begin by providing an update on what we are doing to minimize the impact of the Chinese virus on our nation's students. With many schools closed due to the virus, the Department of Education will not enforce standardized testing requirements, very importantly, for students in elementary through high school for the current year. They've been through a lot. They've been going back and forth, schools open, schools not open. It's been all standardized testing, and, it's we're not going to be enforcing that, so I think you can let the people know. I think probably a lot of the students would be extremely happy. Some probably not. The ones that work hard, maybe not, but it's one of those things. Unfortunate, very unfortunate circumstance. We've also temporarily waived all interest on federally held student loans. They'll be very happy to hear that. And I've instructed them to take that action immediately. And today, Secretary DeVos has directed federal lenders to allow borrowers to suspend their student loans and loan payments without penalty for at least the next 60 days. And if we need more, we'll on federally held student loans. That's federally held student loans. That's a big thing. That's going to make a lot of students very happy. And we have more to come on student loans, more good news for the students, but we'll do that at a different time. This morning, the Treasury Department also announced that we're moving tax day from April 15th to July 15th. So we're moving it out to July 15th so that people will have time, and people will be able to, hopefully by that time, we'll have people getting back to their lives. Families and businesses will have this extra time to file with no interest or penalties. We're getting rid of interest and penalties. However, if you have refunds or credits you would like to claim, you may still file. In other words, you can file early if you are owed money by the IRS. Other than that, we're moving it all the way out to July 15th. No interest, no penalties. Your new date will be July 15th. Today, our team will also provide an update on our continuing effort to prevent the transmission of virus across America's borders. And I watched what's been happening in California with Governor Newsom, and this morning with Governor Cuomo, and I applaud them. They're taking very strong, bold steps, and I applaud them. And we're all working together. We're working very closely together, including those two governors. But I would say, based on the call, the media was there. I think we can say that with respect to virtually every governor on that call. I think every governor. We had almost all of them. If not all of them. And I would say that you could see for yourselves that the level of respect and esprit de corps working together was extraordinary. There was nobody angry, nobody upset. We're able to help them, and that's what we're all about. We want to help. We're doing things that a lot of people wouldn't be able to do. But the relationship with governors and states is, I think, very extraordinary, especially under the circumstances where this just came upon us. We're working with Canada and Mexico to prevent the spread of the virus across North America very closely. You heard what we did yesterday with Canada. And Secretary of State Pompeo will be making a statement in a little while having to do with Mexico and the border. And Chad Wolf will likewise be making a statement. There's a joint comprehensive effort in collaboration with our neighbors. The measure and all of those measures that we're putting in place will protect the health of all three nations and reduce the incentive for a mass global migration that would badly deplete the healthcare resources needed for our people. And so we are working very closely with Mexico, very, very closely with Canada. The relationship's never been better. We're all working toward the same goal. Our nation's top healthcare officials are extremely concerned about the grave public health consequences of mass, uncontrolled cross-border movement. And that would be mostly, and even beyond, but mostly during this global pandemic. Every week, our border agents encounter thousands of unscreened, unvetted, and unauthorized entries from dozens of countries, and we've had this problem for decades. For decades, you know the story, but now it's with the national emergencies and all of the other things that we've declared, we can actually do something about it. We're taking a very strong hold of that, and we have spread the infection to our border agents, migrants, and to the public at large. Left unchecked, this would cripple our immigration system, overwhelm our healthcare system, and severely damage our national security. We're not going to let that happen. So we have a lot of information, and they'll be discussing that in a moment. To confront these public health, to give customers and border protection, the tools to give customers and border protection, the tools it needs to prevent the transmission of the virus coming through both the northern as we did with Canada. We're also working with Mexico to implement new rules at our ports of entry to suspend non-essential travel. These new rules and procedures will not impede lawful trade and commerce. Furthermore, Mexico is taking action to secure our own southern border and suspend air travel from Europe. So we're coordinating very closely with the air travel going to Mexico and then trying to come into the United States. The actions we're taking together with our North American partners will save countless lives. At the conclusion of my remarks, Secretary Azar, Secretary Pompeo, Secretary Wolf, we're going to be also taking some questions with Tony and Deborah, who you've gotten to know very well. But they'll be discussing certain things, and I think you'll find them of great interest. We're going to be providing tremendous amounts of detail over the coming days, but a lot of it will be provided right now if you'd like to find out about it. There's been a week of resolute action, tremendous relations. I invoked the Defense Production Act. And last night, we put it into gear. We moved the National Response Coordination Center to the highest level of activity. I mean, if you take a look at what we did, the level of activation has been increased to a grade 1 level, which is the highest level. We're providing historic support to small businesses and to the states. The states need support. Normally, they do this themselves, but because of the magnitude of it, the federal government has gotten very much involved in terms of getting the equipment they need. So we're helping them. It's a responsibility they have, but we are helping the states a lot. That's why paid sick leave at no cost to employers. We're accelerating the use of new drug treatments. We're advancing legislation to give direct payments to hardworking families. Throughout our country, Americans from all walks of life are rallying together to defeat the unseen enemy striking our nation. In times of struggle, we see the true greatness of the American character, and we are seeing that. A lot of people are talking about it. We're at 141 countries from what they're telling me, and some of those countries are really working in a unified manner, and they're working very unified with us, almost, I could say, a good number of them. Doctors and nurses are working nonstop to heal the sick. Citizens and churches are delivering meals to the needy. Truckers are making the long haul to keep shelves stocked. We've been dealing with the big stores and the big chains, Walmart. They've been fantastic, and others. They've all been fantastic. We've made it much easier for them to stock in terms of travel and travel restrictions. We're lifting restrictions so they can get their trucks on time. You're seeing very few empty shelves, and yet the amount of volume that they're doing is unprecedented because people want to have what they have to have, what they feel they have to have. And they're also buying in slightly smaller quantities, which is good because we're not going anywhere. We're going to be here. So I want to thank all of those very great companies for working so well. Americans from every walk of life are coming together. And thanks to the spirit of our people, we will win this war. And we're winning, and we're going to win this war. America will triumph, and America will rise higher than ever before. We'll be stronger than ever before. And we've learned a lot. We've learned a lot. We've learned a lot about relying on other countries. And I can say that I think in both a very good and a very bad way. Some good things came out of it and some not so good things came out of it. So I'd like to move now to invite our team to provide information on the new measures to prevent viral spread at our borders. And I'll start by asking Secretary of State Pompeo to speak. He's doing a fantastic job. And like everyone else, he's been working very, very long and very, very hard. And he's doing the other more normal jobs of a great Secretary of State. But he got tied into this like everybody else, and he's been really doing a fantastic job. Mike, please.
Thank you, Mr. President. Before I address the efforts that we've been engaged in to push back against the Chinese virus, I want to assure the American people that, as President Trump just said, your State Department, your entire national security team is staying focused on the other diplomatic challenges around the world. Those include reducing risk to America from Afghanistan, holding the Iranian regime accountable for its malign activity, and our counterterrorism efforts against ISIS remain a priority for our team. Our number one priority across those mission sets remains the protection of the American people. The President and our team are very focused on it. I'll take this moment, too, to thank my team, State Department team, who is working long hours all around the world to take care of Americans who are stuck at places around the world. This pandemic. Under the President's leadership this week, we've taken two important steps. First, as President Trump announced on Wednesday, the United States work or other essential reasons. We're grateful to have such an outstanding friend to the North who is committed, as we are, to defeating this virus. I also want to announce today that the United States and Mexico have agreed to restrict non-essential travel across our shared border. Both our countries know the importance of working together to limit the spread of the virus and ensure that commerce that supports our economy continues to keep flowing. Here, too, the United States is glad to have a friend who's working side by side us in the fight. Secretary Wolf will talk a little bit more about the details of how we're working alongside our partner in Mexico to keep our southern border safe and secure as well. On another note, yesterday, the State Department issued a level 4 global travel advisory. This means that all international travel from U.S. citizens should be avoided. In countries where commercial departure options remain available, U.S. citizens who reside in the United States should arrange for immediate return to the United States unless they're prepared to remain abroad for an extended time. If you choose to travel internationally or travel, just urge everyone, as they're seeing information that at one time suggested somehow this virus emanated from the United States Army, this information about lockdowns that are taking place. Every American, indeed, people all around the world should ensure that where they turn to for information is a reliable source and not a bad actor trying to create and flow information that they know is wrong. This is a tough fight. The American people are tougher. Our diplomatic teams are working around the clock to help them keep safe both home and abroad. And we're showing once again the global leadership that America has always delivered. And it's been great to see countries around the world rally behind what President Trump and our team are doing. Thank you.
Thank you, Mike. Thank you very much. And we'll take questions right after this. Chad Wolf, yes?
Right behind you. As we continue to evaluate common sense measures that reduce risk said earlier this week, and Secretary Pompeo, we've reached an agreement with both Canada and Mexico to limit non-essential travel across our land borders. Let me be clear that neither of these agreements with Canada or Mexico applies to lawful trade or commerce. Essential commercial activities will not be impacted. We will continue to maintain a strong and secure economic supply chain across our borders. A few examples of essential travel include, but certainly are not limited to, individuals traveling for medical purposes, to attend educational institutions, for emergency response, public health services, and individuals engaged in lawful cross-border trade. As the Secretary said, the agreements with both Canada and Mexico will go into effect on Saturday, March 21st. Suspend the introduction of all individuals seeking to enter the CDC director has determined that the introduction and spread of the coronavirus in the department's border patrol stations and detention facilities presents a serious danger to migrants, the vast majority of those having coronavirus cases. Many of these individuals arrive with little or no identity, travel, or medical documentation, making public health risk determinations all but impossible. It's also important to note that the outbreak on our southern border would likely increase the strain on health systems in our border communities, taking away important and life-saving resources from American citizens. Tonight, again at midnight, we will execute the CDC order by immediately returning individuals arriving without documentation to Canada, Mexico, as well as a number of other countries without delay. And so, again, CBP is positioned to execute these measures as we continue to keep our borders secure and safe. Before I conclude, let me just wrap up by thanking the brave men and women of DHS, specifically CBP, and across the government for the work that they do day in and day out to keep the American people safe from the coronavirus. The department has a number of frontline officers that have tested positive, as well as others who are self-quarantining, and that I am doing everything that I can to protect these patriots as they continue to defend our homeland during this crisis. Thank you.
Thank you very much, David. Thank you. Yes, Secretary.
Today's announcement is just the latest in a long line of bold, decisive actions the President has taken to protect Americans from the coronavirus spreading across our borders. In January, within 2 weeks of China's notifying WHO about the virus, and with only 45 cases in China, we began screening travelers from Wuhan. Then over time, as the outbreak evolved, the president restricted travel from China, Iran, and Europe. Our health experts say that these measures have been truly effective at slowing the virus's spread to our shores. Just think about this. Italy and the United States both saw their first travel-related case of coronavirus around the exact same time, the last week of January. And yet we have had precious time to continue our work around vaccines, therapeutics, and other preparations, while Italy has tragically been overwhelmed with critical patients for several weeks now. The president today is taking action to slow the spread of infectious disease via our border. Under Section 362 of the Public Health Service Act, the CDC is suspending the entry of certain persons into the United States because of the public health threat that their entry into the United States represents. This order applies to persons coming from Mexico and Canada who are seeking to enter the country illegally and who would normally be held in a congregate setting like a Customs and Border Protection station. It does not apply to U.S. citizens or lawful permanent residents. During this pandemic, a number of health challenges arise when illegal immigrants arrive at our northern and southern borders and are taken into immigration custody. We're talking about significant numbers of illegal immigrants. From this past October through February, DHS has processed more than 21,000 inadmissible aliens at the northern border and more than 151,000 inadmissible aliens at the southern border. CBP facilities were never designed to hold large numbers of people and to protect agents and migrants from infection during a pandemic, nor to treat them for a novel virus if large numbers are infected. When held at border facilities, these migrants risk spreading the virus to other migrants, to CBP agents and border healthcare workers, and even the United States population as a whole. In such circumstances, the kind of social distancing measures the CDC and the president have recommended are simply not possible. On top of that, any resources that we are using to reduce the risk of infection among CBP agents, healthcare workers, and migrants in these facilities are drawing on an American healthcare system that is already fighting the coronavirus pandemic. That's why the president and his administration are taking these important steps to keep Americans and our immigration system safe from these health risks as part of our whole of government approach to combating the coronavirus. Thank you, Mr. President, for the work that you've been doing throughout this crisis to slow the spread of the coronavirus and to keep our country safe.
Thank you very much. Thank you. Tony or Deb, please.
Thank you, Mr. President. So we continue to review the data very carefully from around the globe, as I know many of you are. We continue to see signs that, again, individuals under 20, 19 and under may have severe to be twice in every age group of females. This should alert all of us to continue our vigilance to protect our Americans that are in nursing homes. This requires all of the community, and when you see the sacrifices that many Americans have made, the sacrifices that the service industry has made to close their restaurants, close their bars, and so that the spread is discontinued, and then you really understand how all of Americans must make the same sacrifice. We continue to ask you to follow the presidential guidelines of no groups coming together of more than 10, that if anyone in the household is sick, that everyone quarantines in the household together, and that we continue to focus on those who have the most vulnerability to this illness. Now, to the moms and dads out there that have children with immunodeficiencies or other medical conditions, we don't know the level of risk, and I know you will also protect them in the same way. There just is not enough numbers at this time to really tell them if they're at additional risk or not in the same way that adults are. I don't have any new data. I can see the look on your face of saying, is she seeing something new? I don't have any new data, but I think it's important for us to be as honest with the American people as we can and don't know. Finally, no one is immune. I sometimes hear people on radio or others talking about, I'm immune to the virus. We don't know if the contagion levels are different in age groups, but we know it's highly contagious to everyone. Do not interpret mild or moderate disease as lack of contagion or that you're immune. You just happen to have a better immune system, and the ability to fight the virus in a way that maybe older people or people with existing medical conditions can't. And that's why it's very important at this moment that all can move through this well. But we need every American following the presidential guidelines. Thank you.
Thank you very much. Tony, please.
Thank you very much, Mr. President. I just want to underscore a couple of things that I've said a few times to this group. You may recall that just a week ago or so, I said the two pillars, the two elements of our capability to contain the infection and the surge of infections in this country rely on two things: keeping infections from coming from without in. We've been very successful in doing that with China and with Europe. Now we have the northern and southern border issues. There's a fundamental public health reason for doing that, because we cannot be preventing people from coming in from one area when they can actually go into the other. So that's an important reason. Understand that there's a public health reason for doing that. The second thing I think is really important is what happened in New York today, what Governor Cuomo mentioned about an hour ago, some rather strong issues that have been addressed with his recommendations, not recommendations, essentially orders. Now, we have a group of recommendations and guidelines that are applicable to the entire country. You know them. One of them was Washington, another one was California. Governor Newsom made some very important, difficult decisions. Today, Governor Cuomo did the same thing. And I want to say I strongly support what he's doing. And one thing, as a New Yorker myself, for those of you who haven't figured out from my accent that I'm from New York, as a New Yorker, I know what New Yorkers can do. We're tough. I was in New York City on September 11th, 2001. And I know what the New Yorkers can do. So please cooperate with your governor, cooperate with your mayor. It's very important. Thank you.
Thank you, Tony.
That's great. Thank you, Mr. President. The White House Coronavirus Task Force met this morning. We continue at the President's direction to bring the full resources, not just of the federal government, but in full partnership with our state governments, businesses around America, and a partnership with the American people to respond to the threat of the coronavirus. And I know I can speak on behalf of the President with confidence when I say how inspired we are by the way the American people and American businesses are coming together to help defeat this virus in our country. Millions of Americans are putting into practice the President's 15-day guidelines, and we encourage everyone, even those that are not in areas with significant outbreak, to review these guidelines over the next week and more and put them into practice, and you'll continue to do your part. Later today, we'll be talking with manufacturers around the country governors from the FEMA National Response Coordination Center. The President and I, our entire team at the federal level, couldn't be more grateful for the efforts of all of our governors in implementing the guidance that is being issued, not only from our task force, but also in taking strong measures We reiterated to all of the governors that the President, by putting FEMA in the lead, will continue to implement a plan that is locally executed
Republicans and Democrats at this very hour to thanks to the president's involvement of commercial labs, the public and private partnership, more and more Americans are being tested every single day. And tomorrow, Admiral Gua and FEMA will update the American public on the status of testing and our support of state-based testing efforts that are literally expanding by the hour. On the subject of medical supplies, we continue at the President's direction to pursue every means to expand the supply of personal protective equipment for the extraordinary and courageous healthcare workers that are ministering to the needs of people impacted by the coronavirus. We have a policy of procuring, allocating, as well as conserving the resources that we have in our system. And now that the President worked with the Congress to make industrial masks fully available for hospitals to be able to purchase, to be able to use as protective equipment, we're more encouraged than ever about the availability of those important N95 masks to our healthcare facilities. And over this weekend, we'll be announcing a major procurement from the federal government of N95 masks as well. We're also encouraged that we're finding new alternatives to increase the supply of ventilators. We've mentioned that we have a federal stockpile, some 20,000 ventilators on standby, but that doesn't count the tens of thousands of ventilators that are in our healthcare system around the country. But the President has challenged us to work to free up other ventilators from other sources around the country. And there are and converted to be ventilators for people struggling with the coronavirus. But also, on the President's behalf, on behalf of all of our task force, we want to continue to urge every American and every American hospital and healthcare facility to postpone any elective medical procedures. This will free up bed space, free up hospital capacity for people that are struggling with the coronavirus, and it'll also free up equipment that our healthcare workers need. It is inspiring that we continue to receive reports that businesses around America are donating N95 masks to their local hospitals. Businesses large and small are donating hundreds, in some cases, millions of N95 masks. And I know how grateful the President is, and we all are. And let me close by saying, as all of our experts have said many times, while the threat of serious illness to the average American from the coronavirus remains low, every American can do your part to reduce the burden on your health, on your family, the burden on our healthcare system, and especially the threat to the greatness of the American character is shining forth.
Thank you, Mike. Thank you very much. Okay, thank you.
On your family, the burden on our healthcare system, and especially the threat to the greatness of the American character is shining forth.
Thank you, Mike. Thank you very much. Okay, thank you. Go ahead.
You had a call with Senator Schumer. He says you've now agreed to invoke the Defense Production Act to actually make those medical supplies that hospitals say are in severe shortage. So 2 questions. Is that what you're doing now?
It is. I did it yesterday. We invoked it, I think, the day before. We signed it the evening of the day before and invoked it yesterday. We have a lot of people working very hard to do ventilators and various other things, yes.
So you're using it now to tell businesses
We are
they need to
using
make
it.
ventilators, masks, respirators?
For certain things that we need,
Okay.
including some of the very important emergency. I would say ventilators, probably more masks to a large extent. We have shipped directly to states.
So you
Shipped directly to states.
said you would you were signing this but not invoking it. This is what you said yesterday, and that you would only do so in a worst case scenario. So are we now in a worst case scenario?
We need, no, it's no different other than we need certain equipment that the states are unable to get by themselves. So we're invoking it to use the powers of the federal government to help the states get things that they need, like the masks, like the ventilators. Yes, Steve?
What Governor Cuomo has done in New York, is there any more consideration to a national lockdown to keep people in their homes?
I don't think so. Essentially, you've done that in California, you've done that in New York. Those are really two hotbeds. Those are probably the two hottest of them all in terms of hotspots. I don't think so, because you go out to the Midwest, you go out to other locations, and they're watching it on television, but they don't have the same problems. They don't have by any means the same problem. New York, California, Miami, the governor's doing an excellent job. Governor DeSantis in Florida. We have some pretty hot spots in Florida too. But we're general, and the state of Washington, of course, but that was largely, if you look at it, it was one nursing home that had problems like you wouldn't believe. So no, we're working with the governors, and I don't think we'll ever find that necessary.
We're about a week into your 15-day guidelines. Are you happy with the progress? Would you like to see?
I am happy. Honored by the way the American people are working, because it's work. It's work not to work. This is the first time this has ever happened. And we're working out a tremendous financial package for them so they don't work. Who ever heard of this? Usually you work out a financial package to get people working. We're asking people not to work. Taking this, I mean, so seriously. Yes, John?
Mr. President, question. Corporations and not enough in terms of individuals. What did your conversations with Senator Schumer yield on that front?
Well, I think that really all of that is being discussed right now. We talked about, as an example, buybacks, stock buybacks. I don't want to have stock buybacks. I don't want people spending, I don't want some executive saying we're going to buy 200,000 shares of stock. I want that money to be used for the workers and also for the company, to keep the company going, but not for buybacks. I would, I mean, I haven't spoken to a lot of the Republicans or Democrats on it. We discussed it, and I don't like buybacks. I didn't like them the first time.
Are you and Senator Schumer?
So we're
on the same
discussing,
page?
we're discussing that. We're discussing many
Are
things.
you on the same page with Senator Schumer?
We're not so far away. I'll tell you, we're not very far away.
And to Dr. Fauci, if I could. Dr. Fauci, as was explained yesterday, there has been some promise with hydroxychloroquine, this potential therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no. And the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a that's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
I think, without seeing too much, I'm probably more of a fan of that than maybe than anybody. But I'm a big fan. We'll see what happens. And we all understand what the doctor said is 100% correct. It's early. But we've, I've seen things that are impressive. And we'll see. We're going to know soon. We're going to know soon, including safety. But, when you get that safety, this has been prescribed for many years for people to combat malaria, which was a big problem. And it's very.
But be careful when you say fairly effective. It was never done in a clinical trial. They compared it to anything. It was given to individuals and felt that maybe it worked. So
Was there anything to compare it to?
well, that's the point. Whenever you do a clinical trial, you do standard of care versus standard of care plus the agent you're evaluating. That's the reason why We showed back in Ebola why particular interventions worked.
Sir, on that topic. About the possible therapies, yesterday, Mr. President, you said that they were for, quote, immediate delivery, immediate. We heard
We
from
were
Dr.
ordering, yes, we have millions of units ordered. Bayer is one of the companies, as you know, big company, very big, very great company. Millions of units are ordered, and we're going to see what happens. We're going to be talking to the governors about it, and the FDA is working on it right now. The advantage is that it has been prescribed for a totally different problem, but it has been prescribed for many years, and everybody knows the levels of the negatives and the positives. But I will say that I am a man that comes from a very positive school when it comes to, in particular, one of these drugs. And we'll see how it works out, Peter. I'm not saying it will, but I think that people may be surprised. By the way, that would be a game changer. But we're going to know very soon. But we have ordered millions of units. It's being ordered from Bayer, and there is a couple of companies also that do it.
For clarity, Dr. Fauci said there is no magic drug for coronavirus right now, which you would agree. I guess on this issue,
Well,
then
I think we only disagree a little bit.
Sorry.
I disagree. Maybe and maybe not. Maybe there is, maybe there isn't. We have to see. We're going to know.
Is it possible that your impulse to put a positive spin on things may be giving Americans
not work? And I agree with the doctor, what he said. May work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it. And we're going to see. You're going to see soon enough. And we have certainly some very big samples of people. If you look at the people, you have a lot of people that are in big trouble. And this is not a drug that obviously, I think I can speak from a lot of experience because it's been out there for over 20 years. So it's not a drug that you have a huge amount of danger with. It's not like a brand new drug that's been just created that may have an unbelievable monumental effect, like kill you. We're going to know very soon. And I can tell you, the FDA is working very hard to get it out. Right now, in terms of malaria, if you want it, you can have a prescription. I mean, there's been some interesting things happened and some good, very good things. Let's see what happens. We have nothing to lose. You know the expression? What the hell do you have to lose? Okay?
So when you say Americans are nearly 200, I'll spell out.
John,
Nearly
go
200 dead. What do you say the Americans were scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're the same with NBC and Comcast. I don't call it Comcast. I call it Comcast. Let me just tell you for whom you work. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens, John.
Can I get back to the science and the logistics?
You're
here?
ashamed of yourself.
The units that were ordered, are they for clinical trials or are they for distribution to the general patient population?
We are going to, as I understand it, we are going to be taking samples in New York. Governor Cuomo very much is interested in this drug, and they are going to work on it also after they get a certain approval. We're waiting for one final approval from the FDA. We'll see what happens. But we'll use it on people that are not doing great, or even at the beginning of not feeling
Sort
well.
of fall under the.
And John, what do we have to
modified
lose?
auspices. So this was sort of.
Wait, John. It's been out there for so long. We hear good things. Let's see. Maybe it works and maybe it doesn't.
I understand all that. I'm just thinking the application here. So that would be under sort of a modified compassionate access.
We're doing that, I guess, and that's what it's called, yeah. Yes.
I would like Dr. Fauci, if you don't mind, to follow up on what the president is saying. Should Americans have hope in this drug right now? And sir,
What I'm saying is that it might be effective. I'm not saying that it isn't. It might be effective, but as a scientist, as we're getting it out there, we need to do it in a way as while we are making it available for people who might want the hope that it might work, you're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
Is there any reason to believe it's not safe?
Well, certainly as a drug, any drug, John, has some toxicities. The decades of experience that we have with this drug indicate that the toxicities are rare and they are, in many respects, reversible. What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe, but I like to prove things first. So it really is a question of not a lot of difference. It's the hope that it will work versus proving that it will work. So I don't see big differences here.
I agree.
Sir, your message to Americans who
agree.
are working at home, who have their children in their homes right now, who are
Here we go. Go
homeschooling,
ahead.
doctors who say they don't have the masks they need to do their jobs, your message to them.
My message to the American people is that there is a very low incidence of death. You understand that. And we're going to come through this stronger than ever before. If you get it, if you happen to get it, it is highly unlikely. It's looking like it's getting to a number that's much smaller than people originally thought in terms of the ultimate problem, which would be death. My message to the American people is, number one, you've done an incredible job. Incredible what you've gone through. It's been incredible. It wasn't their fault. It wasn't their fault. It wasn't the fault of 140 other countries where this has happened. And there is tremendous hope. And I think we're going to come out stronger, better, bigger in every way. I think we're going to be a better country than we were before. And we learned a lot. We learned on reliance, who to rely on, who not to rely on. But our country has been incredible, the way they pulled together, including the fact that I just spoke to Senator Schumer. We had a wonderful conversation. We both want to get to a good solution. But it's been really, for me, watching and seeing people that weren't speaking, getting along well, because we all have one common aim, and that's to get rid of this invisible enemy, get rid of it fast, and then go back to the kind of economy that we had, and maybe even better. Yeah, please, in the back. No, in the back, please.
Mr. President, I have two questions, if you'll indulge me. The first question is, many small businesses are concerned that they have weeks, not months, and are worried about how long it'll take.
We're going to be helping them a lot. We're going to be focused, a big focus, and including my conversation with both Mitch and with Chuck, a big focus of that conversation with small businesses, because they are really the engine behind our country, more so than the big ones. They are the engine behind our country.
Second, if I may, sir, are you concerned about members of Congress that may have used information they learned on updates to sell stocks and profit off of this?
I'm not aware of it. I saw some names. I know all of them. I know everyone mentioned Dianne Feinstein, I guess, and a couple of others. I don't know too much about what it's about, but I find them to all be very honorable people. That's all I know. And they said they did nothing wrong. I find them, the whole group, very honorable people. Yeah, please.
Mr. President, so the whole group would include Richard Burr, the head of the Intelligence Committee, and it also would include Senator Kelly Loeffler. And so the question is whether or not they should be investigated for that behavior.
Well, it also includes Dianne Feinstein, a Democrat. You didn't mention her name. Why didn't you mention her name? And I think she's a very honorable person, by the way. So I'm not saying, but you know, it's interesting that you mentioned two people, but you don't mention one that happens to be a Democrat.
Any senator, should they be
I don't know, because I'd have to look at it, possibly, but I find them to be honorable people. Yeah.
You said the other day you see yourself as a wartime president right now, leading the country through this pandemic that we're experiencing. Do you really think, going off on Peter or going off on a network is appropriate when the country is going through something like this?
I do, because I think Peter is, I've dealt with Peter for a long time. And I think Peter is not a good journalist when it comes to fairness.
But he's asking for your message to the country.
Oh, I think it's a good message, because I think that the country has to understand that there is indeed, whether we like it or not, and some of the people in this room won't like it, There's a lot of really great news and great journalism, and there's a lot of fake news out there. They're just making it up. I know that, and I call Peter out, but I call other people out too. And, you know, this is a time to come together, but coming together is much harder when we have dishonest journalists. It's a very important profession that you're in. It's a profession that I think is incredible. I cherish it. But when people are dishonest, they truly do hurt our country. Yeah, in the back. Please, go ahead.
Mr. President, China has been in communication with the United States and also WHO about coronavirus.
Right.
And this all happened almost 2 months ago. Why did you still say if you could have known it earlier? And also you have been calling coronavirus.
Well, I have to say this. We have, and I can speak for myself, but I have some people are upset. I know President Xi, he loves China. He respects the United States. And I have to say, I respect China greatly, and I respect President Xi. Okay?
You have been calling coronavirus.
Can I ask more about stock buybacks? Many of the airlines when Boeing did stock buybacks. Is this a deal breaker for you in this?
No, but I never liked stock buybacks from their standpoint. When we did a big tax cut, and when they took the money and did buybacks, that's not building a hangar, that's not buying aircraft, that's not doing the kind of things that I want them to do. And we're now talking about buybacks. We didn't think we would have had to restrict it because we thought they would have known better. But they didn't know better. In some cases, not in all cases, obviously. Some people did an incredible job. They built plants all over the country. I mean, you'd see what's happened. I mean, we were doing, until this invisible enemy appeared, we never had an economy like this. But there were some companies that used that money to buy back stock, driving up the price of the stock artificially in many cases. I don't like that. I don't like it. And as far as whether or not we'll have that, allow them, when we give them money, because we have to keep these great companies in business because of the workers, frankly, for the most part, because of the workers. The workers are my number one concern. But the way we take care of the workers is we have to keep the companies going. I am fine with restricting buybacks. In fact, I would demand that there be no stock buybacks. I don't want them taking hundreds of millions of dollars and buying back their stock, because that does nothing. Yeah, please.
Thank you very much. One for Dr. Fauci and then hopefully one for you.
Sure. And one thing, Secretary of State Pompeo is extremely busy, so if you have any question for him right now, could you do that? Because you know what I'd like to do? I'd like him to go back to the State Department, or as they call it, the Deep State Department, if you don't mind. I'd like to have him go back and do his job. So does anybody have any question? Please.
Mr. Secretary, can I ask
Go ahead, you want to call somebody?
Yeah, how about you? Only for the
the
Secretary.
exemptions on work travel, can you define that? Is all work, anyone with a work visa can still cross the border? Can you define what, like, the measures that you're taking?
It's a great question. We're working, we're very real concerned about H-2A visas, in particular agricultural workers need to get across. We're going to make sure that we do everything we can to keep that part of our economic lifeblood working between our two countries. DHS and the State Department will work together. We want to make sure and keep commerce between Canada, the United States, and Mexico alive, functional, and prepared for the day that this economy bounces back like we expected it will.
Secretary, Mr. Secretary,
Right back there. And then-
Mr. Secretary, the Mexican government has not announced any travel ban on Europe. Where have you been in touch with them as to when they're going to do this and what it is that they're telling you? And then a second question, they also are telling us and said in a press conference this morning that they will not take back any non-Mexican citizen. Any other third parties will have to, we don't know what will happen to them. So can you address what will happen to those third country immigrants that you are saying that will not be allowed to enter the U.S. and Mexico is saying that they will not be allowed to stay in Mexico either or send sent back from the US?
If I may, I'll take the first one, and then Chad, I'll give you the second one. With respect to travel into Mexico from outside, I spoke with Foreign Minister Ebrard a couple of times about this, so that they're not coming into Mexico and then coming into the United States. I'm very confident we'll do that. We'll make that announcement shortly together.
Again, as we implement the CDC's order, again, we're going to take a number of individuals that cross the border illegally and repatriate them or remove them quickly back to Mexico, back to the Northern Triangle, and back to any other country. So we're going to do that in a rapid fashion. We'll continue to work with Mexico to make sure that Mexican nationals go back, as well as other populations.
But are you sending Guatemalans back to Guatemala or Cubans back to Cuba? What would you do with
Yes.
those third countries that are not Mexicans?
So we're doing all of the above. We're going to be sending, again, individuals back to Mexico, individuals back to the Northern Triangle countries, Cuba, Haiti, all of again, 122 different nations that we see nationalities that come across that border. We'll be sending them back individually to their countries, but also working with Mexico to send additional populations back there as well.
And just to put it, when you said, before you said the non-Mexicans going to Mexico, we're not sending them to Mexico. We're sending them back to their own, back to the country from where they came. Okay, and Mike, please.
Secretary Pompeo, on the issue of disinformation, is there any particular locus for this disinformation, or is it diffused?
It's pretty diffused, unfortunately, but we've certainly seen it come from places like China and Russia and Iran, where there are coordinated efforts to disparage what America is doing in our activity to do all the things that President Trump has set in motion here.
Other than what you're doing this morning, what are you doing to fight back?
Lots of things, lots of work. One of the things we want to make sure is the American people go to trusted sources for that information. But we've made clear, we've spoken to these countries directly that that they need to knock it off, that we don't approve of it.
Did it undermine you at all when the president stands up here and he attacks news outlets calling us untrustworthy?
Somebody else have a question?
Peace Corps volunteers have the Peace Corps volunteers.
Secretary,
Please.
in terms of Americans who find themselves stranded in places where there are no longer flights to get back to the United States, what efforts are being made to help them?
I appreciate that question. To do that, but we have a team stood up at the State Department the repatriation task force that is working each of these instances. So we've heard from individuals, members of Congress. We're trying to get Americans back from these places where air travel has been disrupted, and we'll get that done over time. We'll get it done
Do
successfully.
you have any sense of how big that problem is? Is there any sense of just how big that problem is? How many people?
We don't know the full scale of it yet, but we think we have the largest number identified, and we're working. If there are those who are watching that are long it's going to last.
Have you determined whether Iran is responsible for that rocket attack last week?
So
maybe we shouldn't say it.
So let me just get back to you on the answer to that. And what we can what we can say with certainty is this: we've made clear all along. We have all of them back yet.
And then Secretary Esper's not here, but to get tests to the troops in Iraq and Afghanistan, are you able to give us a progress report on the status of that, if they're able to get tests?
I don't know the answer to that. I know we have State Department officials too who are the Department of Defense to say where there is space available, we'll be able to bring them back on those flights as well. It's a whole government effort to make sure we get them back. They're gonna help us every place they can. Secretary Nesbitt, I've talked about it a couple times.
Thank you, Secretary. Question on Iran again. Is there any consideration to relax some sanctions on Iran during the coronavirus crisis instead of
That's an important question. The whole world should know that humanitarian assistance into Iran is wide open. It's not sanctioned. We've offered to provide assistance to the Iranians as well. I talked with Dr. Tedros from the World Health Organization about this. We're doing everything we can to facilitate both the humanitarian assistance moving in and to make sure that financial transactions can be a problem there. And we want that humanitarian medical healthcare assistance to get to the people of Iran.
But the sanctions themselves, no movement.
We are
the State Department at a time when thousands of diplomats are working very hard around the world to combat this pandemic?
worked with the president for 3 years now. I know how much he values the people that work on my team. I know when I was the director of the Central Intelligence Agency how much he valued the work we did. I know that he watches our team, Dr. Birx, all the team that's working to push back against this virus to keep America safe. I know how much he values them.
What a good answer. Yes, go
Mr.
ahead.
President, can I ask a question? Mr. President,
Very true, too. Go ahead.
Mr. President,
No, behind you.
I apologize.
Please, go ahead.
The news, I have two questions. The first to Secretary Pompeo. The news hours learned that the CDC picked up that there was some sort of virus happening in Wuhan, the coronavirus happening in Wuhan as early as December. When did the CDC start letting other agencies know that there was something in China happening, that this coronavirus was happening? And then when did the whole government approach start to happen?
So I'll let the CDC or
been cases in December, not that we were alerted in December.
Mr. President, the other question I have for you.
Excuse me, we'll do it in a second. Let Mike has to go
May I just
back.
say one more
Let's go
thing?
back to
There's been some discussion about China and what they knew and when they knew it. And I've been very critical. We need to know immediately. The world is entitled to know. The Chinese government was the first to know of this risk to the world. And that puts a special obligation to make sure that the data gets to our scientists, our professionals. This is not about retribution. This matters going forward. We're in a live exercise here to get this right. We need to make sure that even today, the data sets that are available to every country, including data sets that are available to the Chinese Communist Party, are made available to the whole world. It's an imperative to keep people safe. We talk about the absence of data sets, not being able to make judgments about what to do. This is absolutely party to the technical people who we wanted to get into China immediately to assist in this. Every moment of delay connected to being able to identify this the risk vectors, creates risk to the people all around the world. And so this is why it's not about blaming someone for this. This is about moving forward to make sure that we continue to have the information we need to do our jobs.
Mr. Secretary, what message do you think it sends to other countries when you have the President of the United States lashing out at reporters?
I've had my frustration with reporters too. All I ask when I talk to the media is that you listen to what we say and report it accurately, and it's frustrating. It's frustrating when you see that doesn't happen. It's enormously frustrating. We have a responsibility to tell the American people the truth, and those who are reporting on what it is we're doing and saying have an equal responsibility to report accurately.
What message does it send to countries when you're lashing out at reporters?
Being reported that the news media.
I've seen many things at the State Department be reported wildly and accurately on multiple occasions, and I have spoken to those reporters about it each and every time, and I'll continue to do so.
Mr. President, Senator Johnson has suggested.
Well, I'd rather have, if you could finish up with the Secretary of
I
State.
think I've worn them out, Mr. President.
Well, let me
Is
ask
everybody
you both.
finished, Secretary of
Let me
State?
ask you both if that's all right. Mr. Secretary, Senator Johnson has suggested that you and the administration administration may be overreacting. He said, we don't shut down our economy because tens of thousands of people die on the highways. We don't shut down our economies because tens of thousands of people die from the common flu. At worst, 3.4% of Americans will die from this virus, he said. What do you say to people that have that view? That's 11 million people he's talking about.
Well, I can just say the entire world is agreeing with us because they all have their choice, and everybody's doing the exact same thing. We want to shut it out, and we can do that, and we'll see what happens in 2 weeks and 3 weeks. But if we can save thousands of lives and even millions of lives potentially, you don't know where it goes, but you could be talking about millions of lives. So if you look at the world, I mean, you have some very smart people in the world, you have some smart leaders in the world, and everybody's doing it the way we're doing it. I think we're doing a better job than hopefully most, if not all. We're doing a very effective job, but we'll know better in 14 or 15 days. But, you know, you're talking about hundreds of thousands and maybe more than that, numbers of people. And, you know, we can bring our finances back very quickly. We can't bring the people back.
Mr. President, to follow up on that, there are millions of people out there that share that view, that say, I don't really need to shut things down. I don't really need to stay away from stores. I can go to the beach. And those people making multiple actions exponentially, it's the difference between life and death.
Yeah, I agree with that, but I think I'd like to have Anthony answer that, because to be honest, that's what he does. And we had a lot of very talented people telling us what they think we should do.
Thank you, Mr. President. Well, first of all, I think that's a false equivalency to compare traffic accidents with. I mean, that's totally way out. That's really a false equivalency. When you have something that is new and it's emerging, and you really can't predict totally the impact it's going to have, and you take a look at what's going on in China, and you see what's going on right now in Italy, and what's happening in New York City, I don't think with any moral conscience you could say, why don't we just let it rip and happen and let X% of the people die? I don't understand that reasoning at all.
Okay, so Secretary of State will be leaving. Any other question? Go ahead in the back, please. In the back for Mike.
Thank you, Mr. President.
Excuse me, I didn't call on you. Go ahead, please.
Thank you, Mr. President. Two things. In New York, where cases are doubling every day, they fear that supplies are going to run out in a matter of weeks. Yesterday, Mayor Bill de Blasio called on you to mobilize the military to deliver urgent supplies. Yesterday, he said, quote, the fate of New York City rests in the hands of one man. He is a New Yorker, and right now he is betraying the city he comes from. I've personally spoken to emergency department nurses who say that they've been told not to wear N95 masks because supplies are so low. So how do you respond to those remarks by Mayor de Blasio?
Well, I just think this.
When will those supplies arrive?
I'm not dealing with him. I'm dealing with the governor, and the governor agrees with me, and I agree with him. So far, we've been very much in sync. I guess they're not agreeing with each other necessarily, but the relationship with New York, I love New York. I grew up in New York, as you probably have heard, and the relationship's been very good. And I think government and the governor have been getting along incredibly well with the federal government. Okay.
Question for Secretary Wolf, if I could. Just on illegal entries of people who are OTM, how will the turn-back process work? Will they be taken to a common area and then put on a plane and sent back to northern countries or others? I mean, how would that process work?
Detention facilities and the like. So it's going to be very rapid. We're going to obviously take them into custody and then send them back to a port of entry or other means. So it'll be very
Mr. President, who asked
Mr. President,
the checks to Americans, the bill as proposed creates sort of tiers of checks for income. Do you believe philosophically that makes sense?
Well, I believe in a lot of things. I want to get workers' money, and whichever way, the best way to get it. And I want to keep the businesses open too, because without the businesses, they're not going to be getting money for very long. But we're going to be
As
talking.
it's written, is
It next week, by some analysts say as many as 3 million people applying for unemployment, which would be a historic number in a 1 week spread. So is $1,000 check going to cut it? Is that going to be
We're
enough?
not talking about $1,000 check. We're talking about much more than that. We're also talking about doing phases. If this doesn't work, we're going to keep doing until we get it going. And frankly, once we get the economy back and once this enemy is defeated, the invisible enemy, as I call it, once it's defeated, we get the economy back, it's going to all come back to us very quickly. It comes back very quickly. We have a tremendous economy. We do numbers like no other country has ever done before. Number one in the world, if you go back 2 weeks, and still, obviously, but if you go back 2 weeks, number one.
of some aerosol transmission. Aerosol means that it can stay in the air for a period of time because it's in a droplet that's very small and doesn't go down. Is it possible and that there is aerosol transmission? Yeah, it certainly is.
media outlets around the country are as well, that that many more tests are being performed every day, literally by the tens of thousands. And this has only been made possible because several weeks ago, the president brought in the commercial labs, these enormous companies, Quest and LabCorp, working with companies like Roche and Abbott Laboratories and Thermo Fisher, and said, we have this existing system of state laboratories and the CDC processing tests for certain infections. But given the magnitude of this outbreak, the president apprehended early on that it wouldn't be enough to meet the need. And I just want every American to know that literally hour by hour, with the most serious outbreaks of coronavirus, Washington State, California, New York, and others. We've been making sure the tests are in those areas, working closely with those governors. But I think the American people should be encouraged at the progress that we are making. Tomorrow we'll take some time to detail that progress for you, but I would say to any American who might be concerned that they have symptoms, as the president said so well, we don't want every healthy American to get a test. But if people feel that they have symptoms that they identify with the coronavirus, call your doctor. Their doctor can call their state health authorities that can work very closely with our entire team through HHS and FEMA and work to identify the more and more tests that are available every day.
Just so you know, just for the probably 100th time, this administration, inherited an obsolete, broken, old system that wasn't meant for this. We discarded that system, and we now have a new system that can do millions of people as you need them. But we had to get rid of a broken old system that didn't work. It worked only on a very limited basis. And we're very proud of what we've done. It's incredible what we've done. And this system will now serve for the future, for future problems. Hopefully you don't have a problem like this, but something will come up. We have now a great system, and it's almost fully in gear, but it's able to test millions of people. But we inherited a broken, old, frankly, a terrible system. We fixed it, and we've done a great job. And we haven't been given the credit that we deserve, that I can tell you. But the one that really deserves the credit are the American people.
They say that by the end of the month, they won't have basic